Thank you, Chair. I'll be a little bit emotional about this, but you will, and mine may be more of comments, and I may take a little more time. Just bear with me. First of all, there was a video that went around of a doctor who actually, his complaints summarized what you are saying. First of all, I thought it was you, but he had less hair, but hair can grow. So after that video, and Chair, I'll go right ahead and tell you why I'm saying that. And why I'm saying I'm emotional, because I'm a doctor. I have a daughter who is a doctor, and I know what is going through working in an outpatient. And the video explained exactly what you are going through as doctors. Not covered, no treatment, no compensation. And this is what Dr. Eselu Simiyu said. I'm reading this to give the feeling that some of us have. The chair circulated that video. Chair, that is so profound. Even before COVID, some of us have agitated for doctors' welfare, but we have met a silent, already received a brick wall. I have never really understood why doctors are hated so much that everybody feels good when the doctor are shortchanged. In the countries out there, doctors are respected and paid well, with all other trappings such as they have. No worries, and now they concentrate on their calling, and boy, they work hard and they deliver. I then commented later, Mheshimiwa Sabina, and this is important because there's something that you have said. The President gave directions. Mheshimiwa Sabina, as the Chair of Health Committee, you owe it to the people of Kenya to ensure that the President hears this. And I'm saying if she was here, I would like her to take that video to the President. Mheshimiwa Sabina, as the Chair of the Health Committee, you owe it to the people of Kenya to ensure that the President hears this. Please make sure he hears this and truthfully report to us. And Chair wants this to go to the Chair. The Vice Chair wants to go to the Chair. To report to us, the Health Committee, what he, the President, says. For me, it is what you report to us that will show me what the future of healthcare for the people of Kenya is. Health workers are the foundation of health services. When they die, the foundation crumbles. I'm saying that because this is deja vu to me. 1982, except there was no COVID, everything is the same. And then we had a strike. And everybody kept saying, the government does not like this. The director of Kenyatta, the government does not like this. The director of medical services, the government does not like this. The PS Health, the government does not like this. The minister, who was then Mugugu, the government doesn't like this. At the end, we landed in the office of the head of the civil service then, Mr. Kandie, and he started by the government doesn't like this. And one of our colleagues, Dr. Lima, now is in Kisumu, asked, we are tired of hearing the government doesn't like this. Tell us who this government is so that we talk to him. And the answer he got, Chair, now is what I want us to take. He was told, the government is the President and the people he listens to, whether those people hold official positions or not. I think we are there one more time. And why am I bringing these things and sounding off? A lot of the things the doctors have said are systemic. And I'll go one by one. I won't take as much time as you did. University lecturers were not included in the cover. Chair, we have said here again and again, it is time that the teaching hospitals are part of the university, and that is what we wanted for Kenyatta University. and our colleagues here, a gazettement was done when we were on recess. Otherwise, it would have been one staff. The people who work there as doctors are registrars. And here, Dr. was saying, if you're going to train them, they have to leave their places. And then the counties don't want to pay. We have said again and again here that what needs to be done, we need training position that is paid for by the national government as per their mandate. Again, the problem of just the functions being done by the people they have. Chair, this risk allowance, extraneous allowance, all these compensations, this is the origin, Daktari. You will pursue this even after I've died from what I'm seeing. Because I pursued it at your age, you are pursuing it again. This was the original of the allowances. We wanted doctors to be paid better. Everybody said, like you are hearing now, the problem is SRC. Everybody said the problem is the Public Service Commission, because if you pay the doctors better, they'll distort the structures of the salaries. And we said, then what do we do? Then we said, because they work longer, because they are at risk of disease, at that time we couldn't even explain that doctors, nurses, and all other health workers are at risk of disease. COVID has now proved it. 40 years later. And that is why the risk allowance was being paid. Extraneous allowance, because doctors cannot leave a patient on the table during surgery because 5 o'clock has reached. So he has to do. And I'll tell you, at one time, somebody retorted in the government before we went on strike that we employ you as all civil servants to do 8 hours. And we said we are going to do a program, we are going to do a schedule for 8 hours, and we did in Kenyatta, and we were doing 8 hours. It was a big strike countrywide. That is where those allowances came from. Why are they being seen now as something you should bargain for? In fact, Daktari, what you now go for is not that this risk allowance are paid, but these risk allowances now, we want them to be computed and put in your salary upfront. Why? Because as allowances, we are being shortchanged. You are being shortchanged as doctors because they will not be part of the negotiation when you retire or part of the gratuity. Because that is where they came from. Okay, other people then came and said, we are also doing this risk allowance, fine. All the health workers, all the people who work in hospital, the cleaners, sure, they also have a risk allowance. But you have said the level of the risk. If they were listening to you, even PPEs, level 2 and 3, you mentioned. We have that list in the ministry, what level 2 does, what level 3 does, what level 4 does, and the risk they have. And you have done exactly what kind of protection they need. Chair, it took us in '82 to get a scheme of service for doctors and health workers. What he has done is not his duty. That is the duty of the human resource in the ministry to work out and go and negotiate with the government. It's not the doctors to go and put a scheme of service. That's not their duty. Their duty is to go in theater and work. Why should they work out the scheme of service? What protective equipment is needed at every level? Who doesn't know that at this point now in COVID, the risk is even in level 2 and level 3, because this is community transmission. 80% of the people are asymptomatic, but they transmit the disease. I know.
Yes.
Otherwise, I'll just have to leave and say
I really agree. We also focus on way forward as members of Parliament.
I'm giving. Do you realize I'm giving way forward?
I hear you.
Do you know I'm giving way forward?
I hear you.
Yeah. If you listen to my statement, each one of them ends with a way forward. Chair, everybody says this is your calling, medicine is a calling, you have to be patriotic. Who says patriotism is suicide? Patriotism is not suicide. You cannot ask a person to jump into a river that is running because they are patriotic. You must help them. You must help them. We can't do this to health workers. So, again, I'm saying, if you want way forward, these allowances for risk has to be paid not only to doctors, but even to other health workers. And these doctors have even done for you. They can do the level of risk. You pay people at that level. Now, lack of collective bargaining agreement. Chair, people said, I was in that, there was a big meeting where I was. I actually decided, we negotiated. At one point I left because it was sounding like I was being in the earlier strike. And people, Dr. Thuranir, I think you were there. Yeah, you were there also. And you were there, yeah, you guys were all there. If at that time, when I was in the last term of parliament, people agreed on something that it should be paid, and on the basis of that, the strike was called off. Why is it that today that thing is a subject of discussion? Health workers do not know how to lie, because if you lie, the patient dies. So they trust everything you tell them. 2 years down the line, you have not paid. If they go on strike, you want another. How do we know that this new negotiation will again not be a part of a negotiation 5 years later? Use of courts. You know, people go for the letter of the law and manipulate the law to get people sacked. The truth is, when those people who are sacked are at home, there are people who are dying who could have saved if we don't go for the letter of the law. That is the truth. We make public statements that we are going to employ doctors. I know doctors who have come to me looking for work. Why can't we go and employ those doctors at immediately? So, Chair, we just have to do what is happening. Now, when you come to money that was given, contracted workers are not compensated. Honestly, tell me, if you are working for 6 months with COVID patients, why are you not at risk? Why are you not being compensated? And we were with you, Chair, Vice Chair, when we visited. We also asked, you give this thing for 3 months. COVID is going on. What is going to happen in the next 3 months? That is why I said, I wish we were having this meeting in State House with the President chairing. Then all those who he listens to can make their contribution. That is, you remember my definition of the government. The President and the people he listens to. Those are the people we want to listen to this. I don't like this.
All right, easy.
You can't do that to your doctors and your health workers. It's not fair. It's not fair.
Take it easy. We hear you, Mheshimiwa.
It's not fair.
We know, Mheshimiwa. It's painful. Daktari, it's painful, Daktari.
Health cannot be a business.
We hear you, Mheshimiwa. We hear you, Mheshimiwa.
Now, Health Services Commission. Yes, it can be statutory, it can be constitutional. The only reason, and I've not worked as aggressively as it is, as I would have, because I know we have agreed that we are going to have a devolved system of government. And I know that a person who is running an institution will feel disenfranchised if the people that he's working with are being employed promoted, disciplined by somebody else. That's also a reality. The governors are also not wrong to be reluctant. But what is the reason why the doctors are insisting? Say whether I'm wrong. It is because one element of the constitution in this country has never been implemented. The national government, the ministry has policy and standards. Are they able to go to the counties and say, this is not according to standard, this is not the policy, we want it to be done differently? What will be the answer? This is a devolved function, therefore you can't come here. So what is the point of a national government that cannot enforce standards and policies? And that is why the doctors are insisting. Dr. Thuranira, I called you when we were in Naivasha. Can we insist that we have it? And let me tell you why I'm saying, my colleagues, that it can't be, what are they calling this other one? The one that is treated by an act of parliament.
Statutory.
Switch on your mic.
Chair, why they don't want it statutory is because they know that the counties will not listen. My position, these doctors know, is if you have a system where there's a body that sets standards, this is how you employ a doctor, this is how you employ a nurse, this is how you employ a clinical officer, this is how you employ a physiotherapist. After so many years, this is what they do. This is their promotion. This is you pay them. And this is how long you should take before their salaries are paid. Statutory deductions are not remitted to NHIF, and so doctors are not being, health workers are not being covered. A management issue, not even a policy issue. But if you had somebody, so what, Chair, in my view, this country needs is that the policy and standards function of the government, we must find a way where they can be enforced. So a governor can be told, yes, this doctor or this nurse has worked for 3 years. Why has the nurse not been promoted? Their fear is that nobody will listen. So their hope, and my colleagues, I know your hope is that when it's in the Constitution, it will be reinforced. I know you won't have a problem even if it was statutory, and you know that the person who is responsible for it is unable to enforce it at the county level. You would have no problem. I know that. But let me tell you, even some constitutional bodies may actually not be as effective. So what this country needs is the standards and the policy functions to be enforced. Who will enforce it? The health workers believe it is only the Constitution that can enforce it. And I'm telling them, they're my colleagues. I conclude by saying, you people are right. All the things you have said here are right. And don't stop your strike until these things are, I'm saying it in like, don't stop your strike until these things are done. On the Health Services Commission, I think what we should do is make sure it's not only in health, it's in agriculture, it is in water, it is everywhere. The standards and the policy function of the national government is not being done because there is no way of enforcing it. The intergovernmental relations structure is a cordial thing. People talk nicely over a cup of tea and governors go back and the national people remain here and nothing happens. So I would say, when you negotiate that, even if it is not in the Constitution, but what then must be done, what is already in the Constitution, which is not being implemented, is the standards and the policy function of the national government is not being implemented. So if you had a law under the Ministry of Health, and they would go with the law and say, this and this and this is wrong, in according to this. County A, you are wrong. We want you to work with, you do this with the doctors. Training. If the doctors were in Kenyatta or in Moi, and the national government is paying for them, the counties would have the money over that 3 or 4 year period to get another doctor in place. What is wrong with that? Chair, these are clear things. They are policy issues, and we must just go back as this committee and implement the issues. The structure between the training institutions and the hospitals. Why was Kenyatta University Hospital gazetted as a parastatal after this committee had recommended that for once in Kenya, we try a true university hospital? All over the world, those are the hospitals that are most known. Why? Is it business? Business people are listening to me. You have killed more people than the health workers going on strike. That is the truth. That is the truth. We can't do that to this country. Some of us have dedicated our lives. Some of us, people may ask, they worked for so long. Why at the end of their life, they are not living in mansions and flying helicopters? Because we know if we do that, the people suffer. I'm sorry, Chairman, but to me...
you have all the time. You have all the time, Daktari, you know.
We can't go on like this.
Yeah.
I'll be with you if I have to leave this job. I can't see what we saw in 1981. The same thing.
Thank you, Chair. Thank you, Mheshimiwa Daktari. I had to give you enough time because of your experience. Kindly, our team to check on the doctor, give him some water. Yeah. So I'll give it to Dr. Mulgor.
Thank you, Chair.
For more news, subscribe to Kavik TV on Facebook and Kavik TV on YouTube.